Hello and welcome back to Dr. Show Cares. Today we're going to be talking about unveiling the unspoken, and it's your guide to genitourinary syndrome of the menopause. And I've written it as sort of a letter to uh, the dear ladies who follow this program. Dear women, get ready to dive into the depth of genitourinary syndrome of the menopause. This journey promises enlightening insights into a vital topic that profoundly impacts your well-being. So what is GSM? Genitourinary syndrome of menopause is a complex web of chronic conditions that affect your urinary tract, vulva, and vagina due to the dwindling estrogen levels during menopause. It's time to dispel the silence surrounding this issue and shed light on its significance. How prevalent is GSM? It's very predominant actually amongst mature women, with 50 to 70% of postmenopausal women experiencing symptoms. However, surprisingly, even 15% of premenopausal women may face similar challenges when they have surgeries or hormonal imbalances, particularly in the postpartum period and at other stages in life. So let's debunk the misconception that these symptoms have to be borne as an inevitable part of aging, because even though it will get worse without treatment, there is treatment and there can be help for GSM. So let's talk about the factors that might cause GSM. So there are multiple contributing factors. So not having vaginal childbirth, excessive alcohol consumption, obviously having had your ovaries removed, which causes a surgical menopause, then decreased sexual activity, because some of the symptoms of GSM make women feel like they don't want to engage in sexual activity. That then creates a negative spiral. Smoking, lack of exercise, and obviously having underlying health conditions, particularly urinary tract conditions and vaginal conditions, can obviously make these things worse. So identifying these key factors can help understand those who are at higher risk and enable targeted interventions. Now, how does GSM happen? It's the declining estrogen during menopause that reshapes the urinary system, the vulva, and the vagina. That's why one of the old words for this part of this condition used to be called atrophic vaginitis. We no longer use that word because it's much more encompassing, but it describes a breakdown of the tissues around the vulva and inflammation around the vagina due to that lack of estrogen. So it's a transformation. It causes thinner tissue, altered muscle dynamics of the pelvic floor, and changes in the vaginal skin layers. And women can even lose the normal vaginal architecture, the normal anatomy. So what are the symptoms? So there's vaginal dryness, there's itching, there's pain during sex, insufficient lubrication during sex, and that can sometimes lead to bleeding after sex, and that's also called postcoital bleeding, diminished arousal and libido, difficulty having an orgasm. Sometimes women notice painful urination, increased urgency in urination, and this is probably one of the most challenging things, the accident, also known as incontinence. I often say that the people who make those incontinence pads are the biggest winners here, because so many women are so embarrassed they don't go and speak to their doctor, and there is help. Women might also be prone to recurrent urinary tract infections. Now, we've talked about the prevalence of GSM, but the vaginal dryness in particular, um, about 4% will find this starting to happen in early perimenopause, but by 25% by a year after menopause, and almost 50% 3 years post-menopause. That is staggering. And the fact that we're not talking about this more is astonishing, because it's about the impact and the distress caused by the dryness and painful intercourse. And many women just end up giving up on intercourse, and this should not be. Intercourse is a very important part of our well-being, and therefore what we need to do as doctors is to help women that deal with these symptoms. So it's not a fleeting inconvenience. It can cause significant shifts in life. It can transcend the physical, affect relationships between partners, self-esteem, and that sense of intimacy within a relationship. And unlike certain menopausal issues that can improve with time, the symptoms of GSM actually get worse over time. So it's not just a condition, it can be a disruptor. So how is it diagnosed? So this is where medical history and examination is very important. So we can look, a doctor can get the symptoms, or a healthcare professional can get the symptoms and examine and see what exactly is going on, because there are certain other things that can occur alongside GSM. So if you're experiencing these symptoms, it's important to be seen by a healthcare professional that knows about these symptoms and how to diagnose and manage it. So these are the treatment choices, and we're going to talk about it in a minute. So the options vary, and they're based on symptom severity, and it's a very personalized approach to managing this problem. So the first thing is non-hormonal therapies, and I cannot overstate the importance of lifestyle changes. So the vagina likes to be moisturized, but it doesn't like moisture. So it doesn't like to be wet, but it likes to be moisturized. So when I say moisture, wearing things like silk underwear, not cotton, can cause irritation because of unnecessary moisture. So you want to wear nice, cool cotton underwear. But very, very importantly, you want to wash with you want to stop washing with soap and instead wash with warm water or with an emollient. And I often really strongly recommend that women with genitourinary syndrome of the menopause wash with an emollient, because that also helps keep the vagina nice and moisturized, and that creates a nice barrier and helps keep um, the right environment for the vagina. Using strong things like soap or antibacterials will remove all the nice normal flora and the bacteria, the good bacteria that live in the vagina, and that can cause problems. So it's really, really important to stay away from soaps, perfumed products, anything that can irritate the vagina. So that's very, very important. Now, lubricants and moisturizers. So moisturizers, there are vaginal moisturizers, and these are very good. A very good brand is Yes. There's also Replens, which is available over the counter in the UK. Now, vaginal moisturizers you can use regularly to keep the vaginal area nice and moisturized, as I described earlier. Lubricants are to be used in the context of intercourse. So it's very important. And there are specific types of lubricants, so water-based or silicone-based lubricants that can be more helpful for the more mature, the more experienced vagina. Now, you can also use a combination. Now, some of these lubricants can impact condoms. So if you are using them with condoms, you have to be very careful to make sure that they are compatible with the type of condoms that you're using. So that's just something to be mindful of if you are still perimenopausal and at risk of getting pregnant. Now, physiotherapy is vital, and That can be yourself doing pelvic floor exercises and learning how to do those, or in certain situations, it would be advisable for you to see a women's health physiotherapy to give you targeted exercises and treatments to help with some of these symptoms. And these can really be life changing. Now, hormonal therapy. So we've talked in previous conversations about systemic HRT, and this will be used for all symptoms of perimenopause and menopause, and we've talked about that, and that can also cause improvement in the symptoms of GSM. But we can actually use intravaginal estrogen purely for the GSM symptoms, and this can be used alongside systemic HRT if there are other symptoms and systemic HRT is appropriate, or on its own. And there are uh, intravaginal tablets or pessaries and creams that can be used, and there are a variety of doses. There's also a ring that can be used. So again, this is something that you can see a healthcare professional about to get personalized advice. Now, the intravaginal estrogen is very, very low risk, and there are very few people who can't have this. Most women can, and most women can actually use them for life. So the only people that there's only a small group of people who have active breast cancer, or have had a previous hormone sensitive breast cancer. Those are the only people in which more discussion and more consideration will be taken in terms of intravaginal estrogen. But for the vast majority of people, it's considered to be very, very, very safe and low risk. There is more detail on this on the blog. So, ladies, GSM can affect various aspects of your well-being. Uh, Diagnosis and proper management are very, very, very important. So, consult a healthcare professional if you experience symptoms. It's time to break the silence and empower yourself. I'm Dr. Show. It's been lovely having this conversation. We'll see you next time on Dr. Show Cares.